I'm your host, Dr. William Dodd, from the East Tennessee State University Health Pediatrics Adolescent Medicine Clinic. This podcast is not intended to provide medical advice. If you or a loved one are working through medical problems related to today's topic, please consult a personal physician. I have no conflicts of interest to disclose. Today we have a very interesting discussion on the impact of chronic physical illness on mental health of adolescents and young adults. I'd like to welcome everybody to the Growing Stronger Together podcast. I'm Dr. William Dodd, and today it's my pleasure to welcome a special guest, Dr. Haley Bradshaw. Dr. Bradshaw attended ETSU, both for undergrad and medical school, and she's stayed here for pediatric residency. Dr. Bradshaw is interested in cardiology and has a fair amount of outreach too. She does book reviews on TikTok. Dr. Bradshaw, what's your TikTok handle?
It's the Page Sage, and I like to focus on chronic illness and disability representation in fiction, so kind of meshing my love of medicine with my love of reading in a way, and that's given me a pretty good following so far. That's
really cool. Do you have any book recommendations for our audience?
My favorite one is called The Whispering Dark by Kelly Andrew. She is an author who lost her hearing to meningitis as a kid, and so she writes about a main character who is deaf and trying to kind of prove herself to the world, if you will.
Oh, that's really cool. That's sounds like an interesting read. So.
Yeah, it's one of my favorites.
And that also kind of brings us to, in a way, to our topic today, and namely chronic illness in adolescents and how that affects mental health.
Yeah, it's become something that's been dear to me as someone who has congenital heart disease, and kind of realized that linked pretty well with my own mental health issues. And so wanting to go into cardiology, of course, I've been kind of wanting to see how we can better the care for adolescents with chronic illnesses, so that their mental health is optimized while they're struggling with these other physical issues.
It just kind of, I guess, really can make things just that much harder.
Right. And there's been several studies that have shown that, I think there was one that actually gave a really good graphic about how everything links together from like an interpersonal level, community and society level. So whether you're living in poverty, things like that, contributing both to chronic diseases and then into your mental health, and everything just kind of feeds back into it, and you can't optimize one without optimizing the other.
Sure. And even for physically healthy people without any sort of chronic illness, mental health problems are pretty prevalent in young people these days, aren't they?
They are. About 1 in 7 adolescents in the United States have a mental health disorder, and suicide is actually the third leading cause of death in people from 15 to 29-year-old. And so it's really becoming an epidemic, especially after COVID-19 kind of tanked everyone's mental health in a way. I think it really brought to light how bad our mental health is, especially for our kids in the U.S.
Yeah, one thing I see a lot in clinic treating adolescents is depression. Is that fairly common?
It is. In kids that are 12 to like 17 years old, about 20% of them have had at least one major depressive episode, and 15% out of those 20% are classified as having had severe impairment during their episode. But only 40% of those kids have received any kind of treatment, which I think is really lacking. There was an adult study that actually showed that 50% of people with depression even have proper access to treatment, which I think could probably be really highlighted in our region and rural regions across the country. Yeah. Mental health access is very lacking, and that's doing a disservice to these kids.
Yeah, and one other thing I kind of see in clinic a lot of times, I feel like, is that, and I can relate to the dilemma of a parent. You raise a kid, kids like to complain a lot of times. Sometimes they need to be kind of pushed in the right direction, and I think kind of there's that parenting impulse to kind of overcome difficulties by pushing your child. And sometimes I think it's hard for parents to know, like, when do I push my kid to get out there and do sports and, just chalk up problems they're having with relationships and friendships and that sort of thing to normal teenage type things. And when should I be worried about like a medical condition like depression that we need to treat medically and or with counseling, and that's just a hard thing to figure out sometimes.
Yeah, and I think that kind of highlights the importance of the annual well-child check and having the screeners that we do have to kind of help suss that out a little bit more, which can be hard when parents are looking over kids' shoulders as they fill out these screeners.
Oh, for sure.
Which often happens, but I think that's at least an important part of kind of opening the conversation for these kids and kind of normalizing mental health for them so that they might feel a little more open to talking about it.
Absolutely. And yeah, that's the other interesting dynamic you see sometimes is, like a 19 or a 20-year-old, they probably need help with a lot of things. And, parents kind of need to step up and help them with, like renting a place to live or making a big purchase or things like that. But, on the flip side, a 15, 16-year-old, they have some ability to kind of manage their own affairs and know when there's something wrong and identify their own symptoms and condition.
And I think that's part of the art of medicine to peds, is trying to remember that the parents are kind of your patients in a way still, and coaching them on how to kind of start to give that independence while still setting boundaries for the kids and things like that.
Oh gosh, I'm med peds, and so I work with internal medicine patients, and a lot of colleagues on the internal medicine side will tell me, like, I don't know how you do pediatrics. It just kind of adds another layer of complexity to it, for sure.
It does.
Well, and is depression in adolescence, is depression the most common mental health condition?
It actually isn't. Anxiety disorders have become the most common mental health disorders for kids. And I feel like that kind of has been fed into by like media and how that has grown in these kids' lifetimes and things like that. I think separation anxiety was actually the top most common, which I thought was interesting. But of course that's in younger kids typically. But yeah, there has been a lot of research going into kids with anxiety disorders and how that kind of feeds into some of their chronic illnesses and kind of feeds that cycle.
Yeah. And well, what about, are there any specific medical conditions that are kind of linked to anxiety?
So, asthma has actually been one that has been linked to the development of anxiety, particularly in adults. But there has been a study in kids that has shown if they have anxiety along with their asthma, they have more asthma symptoms and symptoms that are of greater severity than kids who just have asthma without anxiety. And I thought that was really interesting, especially because asthma is such a day-to-day thing, just like anxiety is. Those kind of feeding into each other and trying to figure out how to manage something day-to-day seems like a really hard thing to do for kids.
It's like a cycle. They both make each other worse.
For sure.
Well, and what about some other conditions? What about, say, for a kid who has suffered some injuries like burns or...
Yeah, so there was a study done on a subset of pediatric burn patients to see how many of them were being treated with anxiolytic medicines. And they found that for kids that had greater than 10% of their body surface area associated with the burn, there was a great increase in the percentage treated for anxiety. I think it was something like 5% or less if it was under 10%, and then like 30 to 40% for those greater than 10% body surface area.
Oh gosh, that's
which
huge.
Yeah, I wonder if some of that is associated with pain, and they're trying to manage some of the anxiety that comes with pain versus something like if they have any kind of PTSD or things like that.
Yeah, there has to be a strong correlation with trauma to burns. Yeah,
I thought the most interesting fact that I found in all of my looking for this podcast was that 35% of adolescent cancer patients were found to meet criteria for PTSD in their lifetime versus 7% of adolescents who had experienced abuse.
Oh gosh.
Which I thought was super interesting because we typically think of PTSD as a trauma response, usually to abuse or something like that. And we don't tend to think of like the medical PTSD and things like that, but I thought that was incredibly interesting. And then linking off of that study, they talked about how 21% of kids who had been admitted to the ICU were found to meet PTSD criteria, and none of the kids who were admitted to like just the regular floor of the hospital developed PTSD.
Yeah. Well, and you've been on HEMONC rotation fairly recently. What sort of, I don't know, what sort of things do these patients go through that causes PTSD?
I think a big part of it is going back to kind of that relationship with parents. If the kid is old enough to kind of understand what's going on, I think a lot of the anxiety can feed in from the parents. Yeah. And even if they're not quite old enough to understand, I'm sure just the energy of the parents feeds into them as well. And then, of course, there's the endless medical procedures that they have to go through, the chemotherapy drugs that are making them sick. I'm sure the anxiety of like the moment you get a fever, that's a medical emergency, just kind of feeds into those things. And they're going through it for years on end. And so I can see how some of this anxiety about your body and what it's doing daily feeds into just a generalized anxiety.
Oh, I'm sure. And also, I think chemotherapy kind of gets a bad rap justifiably. Those are hard medicines, and a lot of times kind of invasive type procedures that those kids need to kind of maximize their chances of a cure.
And I'm sure for kids, especially the younger ones that don't quite understand what's going on, there's a lot of questions about why are they doing this to me? Because I'm sure it seems like we're hurting them for no reason when it's hard to understand how sick they truly were and that they need this medication. So I'm sure there's a lot of psychology that goes into a cancer patient and the journey that they go on.
Yeah, which really underscores the importance of child life and kind of helping kids behaviorally through things.
Oh, for sure. They are my favorite people in the hospital.
Well, and what about some other conditions? What about diabetes?
Yeah, so I think it's really interesting that kids with type 1 diabetes are twice as likely as kids without diabetes to develop an eating disorder. And I think it kind of highlights that diabetes is a condition where you have to constantly think about what you're eating. And that kind of lends into disordered eating. For type 1 diabetes, bulimia is the most common disorder. And these patients, it kind of becomes a cycle because once you develop an eating disorder with diabetes, you're more likely to have poor glycemic control. You have higher rates of hospitalization, higher rates of complications like retinopathy and neuropathy, and then a higher risk of premature death. And I think all of those things can feed back into that mental health issue of maybe not even wanting to eat because you have poor glycemic control, which can be unhealthy in its own way.
Yeah, kind of a cycle in that as well.
And we've had patients with type 1 diabetes in the hospital that have either disordered eating or suicidal thoughts, and they are some of the most challenging patients to treat because they typically have ready access to one of the most lethal drugs they can, insulin.
Yeah.
And it just really underscores the importance of treating their mental health not just as in the moment, but as a precaution as well.
Yeah, and as you know, diabetes as well as a lifestyle illness. It requires regimented behavior, and if you're not motivated, if you're depressed, it's just hard to keep track of that for somebody without a mental health condition, much less a depressed person.
And I wonder if some of that goes into kind of a social anxiety as well, particularly for school-age kids or teenagers, not wanting to be seen checking their sugar, not wanting to be seen giving injections and that kind of thing.
Yeah, it's kind of a lot for a kid to worry about.
For sure.
Well, what about heart disease?
So most of the studies for heart disease have been done in adults. I thought it was really interesting that congenital heart disease has been linked to development of sleep disorders. I've always been a horrible sleeper, so I wonder if some of that is with my congenital heart disease. And going off of that, there was a study in adults that kind of talked about several subsets of patients with chronic illness. Of course, we talked about asthma being linked to anxiety disorders. Kidney disease, they found, was linked to depression. And then they also stated that diabetic patients were 2 to 3 times more likely to develop depression in their lifetime.
Gosh.
And then where I had mentioned like how lethal insulin can be, diabetic patients with depression have a 46% increase in all-cause mortality compared to diabetic patients without depression. And I think that really highlights what you had mentioned of like not even wanting to get out of bed to check your sugar or take your insulin, and then as well as those suicidal thoughts, and having ready access to lethal means.
Well, it's not a good combination.
No.
But what about, are there any other impacts on kind of health and other chronic conditions to kids with chronic diseases?
Yeah, so again, most of the studies have been in adults, but there's of course been shown to have an increased risk of developing chronic conditions if you have anxiety or anxiety and comorbid depression, which I think really highlights kind of that feedback loop of you have anxiety or depression, and that feeds into every part of your life and your lifestyle. The rate of developing chronic conditions was particularly high for women of all ages, including teenagers, if they had anxiety or anxiety and depression. The study showed that people with depression also develop heart disease at higher rates than those without depression, even when you account for like family history or personal history. They were more likely to have an MI and things like that. And then kind of talking about the lifestyle side of it, they found that 32% of adults with mental illness reported tobacco use versus about 10 to 12% of adults without mental illness had tobacco use. And so I think that really is one of those lifestyle things that feeds into, if you are kind of self-medicating your mental illness with tobacco, that is not at all going to help your physical well-being. Yeah. And then it kind of snowballs from there.
Just kind of pouring gasoline on the fire.
For sure.
Well, Dr. Bradshaw, I think we are running out of time, but this is a interesting topic, and it sounds like a broad topic, a very big topic.
And I think there's a lot of room for more studies, especially in adolescents in particular. But I think it really highlights the importance of having good mental health care and ready access to it.
Absolutely. So, all right. Well, thank you so much for joining us, Dr. Bradshaw. I've enjoyed our conversation.
Thank you for having me.